Excuse me if I speak quickly, and excuse those who are on a small screen, you might not see some of the images. I'm going to give you a whirlwind tour of what we do here in Mendip, which has a practice population of 115,000, and specifically what we do in Frome, which has a population of about 28,000. This is from the background of a community development social prescribing service, which maps everything that's out in the community. It started with a doctor who said, there's so much out there in the community, I just want to know what's out there. So I went and mapped everything, put it on a website, so anyone can find out that information. GPs have that information at their fingertips. They can print out information on bereavement, on exercise, on men's sheds, on women's sheds, on someone who can look after their pet if they've gone into hospital. It's there at their fingertips. All that information that's out there, we communicate via social media, radio, newsletter, not about our service, but about what's out there in the community. We do community development, so where we see there are gaps in the community, we can work with the community to help them fill those gaps. We run talking cafes, which are places where people can be signposted to all this support. So it's not just a website, it's not just social media, it's a physical, real place where somebody can go and speak to someone to say, where is the group that I can do a health walk with, or where is the men's shed, where is the carers groups? That's a physical place. For people who have really complex needs, we have one-to-one workers who can have someone who walks alongside them. And once again, looking at the fact that there's a huge amount of support out there. It's not just the website, it's not just the social media, it's not the physical places, but we also have human beings called community connectors. And in Mendip, we have over 1,400 community connectors. They're not volunteers. As Tracy said, they've not got DBS checks. They're just people who signpost friends, family and neighbours to support in the community. Because we don't want anyone to say, if only I'd known that. We want everyone to say, I do know that. So our dream is that the whole of the district here and the whole of the town of Frome knows that there is support available and where to find out about that support. So that's kind of where we've been over the past 8 or so years. What's happened as a consequence of an article that came out by George Monbiot in The Guardian was we have had a huge amount of interest in our work. What we're doing isn't particularly different from other areas. I think we just had this interest. So bits of our model have been shared across England, as far away as Australia, Canada, New Zealand, Denmark, Sweden. We're not saying you need to do it one way. We're saying there are lots of different ways people can do it and you know what's right for your area. But it's really about not what we're doing, it's about what the whole community is doing. So that we can't it's not us that have done it, it's the whole community doing it together. But what's the bit that's most replicated? What's the bit when people come to our conferences or give me a call or I do a presentation? The bits that most replicated are our talking cafes where people get together, but also our community connectors, those 1,400 people who are sharing that knowledge about what's out there. So we're working on that, and we now want a town-wide, district-wide network of connections. So we've got our community connectors. Can be anyone, sixth form students, supermarket staffs, taxi drivers, hairdressers. They just come out of the woodwork and say, we want to be trained. We can train them on a park bench, in their supermarket, wherever it is. We have digital connectors because we're calling up all those people on the shielded list and the most vulnerable list from the GP practices. And a huge thing is they want to be able to book their priority slot at the supermarket, but they can't get online. They want to be able to speak to their daughter in Australia or just down the road, but they got their iPad, but they don't know how to use it. So our digital connectors don't help people get online one-to-one, but they're empowered with the information to be able to spread that to friends, family and neighbours. Same again, planning ahead connectors. All those people out there who aren't talking about death, dying and what happens when we become less well. Well, we're training up people to be able to have those conversations, not volunteers, just empowered people in the community to be able to have those conversations with friends, family and neighbours. Hearing aid connectors. Who's cleaning and retubing people's hearing aids nowadays? I don't know, the clinic here in Frome Medical Practice has stopped. So we've seen that gap. Lack of hearing can lead to a huge amount of isolation and depression. So we're training up the community how to clean and retube hearing aids. We don't know how to do it, but we found out videos that have been approved that we're going to spread to the community. After that, hopefully we're going to be able to go into care homes to be able to train people up, which is what we were doing beforehand. So this is really about us working with the issues and the things that are out there in the community now. Our Let's Connect projects, so this is our kind of phase 2 of the first slide I showed you was phase 1, is we're really curious about, I often walk out with my name tag on because I've been at a group or something, and people say, hello Jenny, or they smile at me at the supermarket. So we've got a group of 20 people who have said that they will, for a week or a month, whatever it is, go out around their town with their name on. And we're going to see what happens, what the ripple effects are of those 20 people. And maybe then we might set up this project called A Town of Names. What happens if everyone who wants to have their name wears their name? We're just being curious about that. A town that writes, we've really seen that there are people hugely isolated now. So we're setting up this pen pal service where people can write a letter or a postcard, and a volunteer actually cycles around the town and drops it off in people's house. So the connection is made with the person who writes the letter, but also with a volunteer who drops that off once a week. We're starting walking taxis. We've seen a huge amount of people who don't want to go outside of their house. They just need somebody to help them get from their house outside of their front door. So walking taxis is a project we're working on, which is actually a human being can come socially distanced and help them walk outside their door to the park or wherever it be. And finally, I saw the most amazing booklet that's here, which is by Every Life Matters in Cumbria. And they really kindly said that we could copy it and localize it. So this was on a Thursday. On Friday, we'd copied it, we'd changed all the links in it, we got it to the printer, and now we have 47,000 leaflets of these books, which go from general well-being through to thoughts of suicide. And we have volunteers in the community who are delivering it to every household in Mendip, 47,000 households, not by us, but by that community, which is empowered to do things, to help each other, to help out. And I would suggest that that person, that volunteer who's putting that leaflet through that person's door, knowing that that might just touch someone's life, what an amazing impact that might have on people. But that has been easy for us, I think, because we've been working for years and years and years on this difference of making connections and those layers of connectedness. And that's it from...
Thank you very much, brilliant. Okay, one interesting question that's come up here is, how much are you able to engage more, or is anyone able to engage more intensively with people who may be hard to reach or who've got relatively complex and severe needs?
Is that to me?
Yeah.
Yes. Okay, so because we work in the GP practices and we work very close with the mental health team and we work very close with the hospitals, so in a way we have, those are the people that we work with a lot when we work with people one-to-one. But often it's the community that might come to us saying, there's a person who comes to the supermarket usually quite often, and actually they're looking really like they're not coping at the moment. So often it's the other way around. It's not the mental health services that are signposting people to us, but it's the community that are signposting people to us, who we can then help link in to services that we might need. But we're always curious about how we can work with people who are not hard to reach, to then reach out to those people who might be less easy to reach. For example, people who are getting prescriptions, we've sent out lots of leaflets with the people who are housebound, and therefore they're having their prescriptions delivered to them. So we're always curious about ways that we can help hard to reach people, but we don't focus on that. We focus on the easy to reach people, and that's how they can communicate, for example, the Community Connector program, to those more hard to reach people.
Brilliant. Thank you very much. Thank you. That's a fascinating talk. Thanks.